I'm Karen Forgie. I'm a full-service family physician out here on the Sunshine Coast, and I've been here since I was a resident back in 1991. I started out as a nurse practitioner or outpost nurse and midwife working in Newfoundland and Labrador, and what I really liked about all of that was the small-sized communities, getting to know everybody there, and being able to do so many different things because the role was so general and allowed for so many opportunities. And I was very clear to everyone that I was going to be a rural family physician. So 30 years later, I have worked in Labrador, Nunavut, Northwest Territories, Northern BC, and of course on the Sunshine Coast. For all of those reasons, loving these small communities, being able to do many different things. I like the swift pivoting of the work and the generalist work that we can do. I think that rural physicians require a lot of advocacy because most changes and attempts at improvement in healthcare start in urban and sometimes don't fan out to the rural area. So it's been very important for me to work with my colleagues, with other rural physicians, to try to improve the healthcare of the communities and the health of the physicians and the ability of those physicians to provide the best care possible. We need more and more physicians in leadership roles at the community level, at an organizational level, and all the way to a government level to be able to improve the health care of all of our communities. Somewhere along the line, I realized that change requires action from those in the know, and that skills can be learned. Once I started doing some of this, I really enjoyed it. I felt that I was able to be the point person for certain aspects of advocacy and roles within the healthcare system. And I think one of the things that I would like to see improved in myself is the ability to bring on new leaders, because we need more young leaders, mid-practice leaders within the physician population to help mold and move things forward for healthcare in BC. There's a skill to encouraging residents and medical students to think outside the box, think of possibilities, think of how things could be locally improved and how one can lead even on one issue and make a change that's positive for that community. The Sunshine Coast and rural has always been my happy place. I like the size of the community. I like that people here are generally not in as much of a rush as they seem to be in the city. And I just like the variety of the landscape. Rural is just a bit slower pace, more nature, less skyscrapers, and I think it has a lot of people here that are interested in adventure and relaxation and find it a great place to retire. I would say that one of the biggest things that I would recommend to my colleagues is that they need to find a little place where they can lead to, because their interests, their knowledge is valuable.